Hi, girls. I'm having a little coffee date with the girls. Say hi. Hi. We saw the Easter Bunny today, and now we're having coffee. We're having a good time. It's just a girls' day. Hello. Hello. Okay, give the bunny back. Say bye-bye, Mr. Bunny. Ophelia. Okay, Ophelia. Say bye, Mr. Bunny. Yeah. You want to eat, Ophelia? Let's eat. Come on, we're going to go. Yeah, say hi. Say hi. Little bunny. Yeah. Go say hi. Say hi. We're going to buy coffee. You don't want to say hi? She's nervous. It's a bunny. It's a bunny. You don't want to say hi? Look. Come on. Say cheese, Ophelia. Look. It's a bunny. Mr. Bunny. Mr. Bunny. Okay. Let me take a quick picture. I'm going to get the coffee. Okay? Okay, we're going to take a quick picture with the bunny. You ready? Okay, say cheese. Okay, 1, 2, 3, cheese. And take one long ways. Ready? You take a picture?
Bunny.
Yes, say thank you, Bunny.
Hello.
Say thank you, Bunny. Hey guys, welcome back. Excuse my laundry. The rest of the room is also a hot mess, but y'all not gonna see that. We are going to fill the box. You're like, fill the box with what? With drugs, okay? Fill the box with drugs. So, I used to have this really cute little canvas tote when I gave birth to my last child. And it was like you could put your diapers in it and the creams, and it would be like our downstairs caddy, diaper caddy. And then I thought I was done. I wasn't gonna need anything like that to help me because the baby was getting bigger and we were getting more mobile with her, and I was recovering from my C-section, and I gave it to my daughter. And then poof, 9 months after giving birth, cancer. Okay, the breast cancer club. So when I gave it to my daughter, she there's like paint all over it and glitter. It's nasty. So we're not gonna use the caddy. We're just gonna use a big old box. And when I show you how many things I'm gonna be putting into this narco box, recovery box, you're gonna be like, yeah, sis, you need a box. Okay, so first things first. We are going to be camping out downstairs in my living room. I'll give you a tour a little bit later. And so we need to create a space where I am comfortable and I have everything that I need right there. First thing, a neck pillow, okay? You need a neck pillow. Whenever you have abdominal surgery, your whole body's gonna hurt because when your core is out of it, everything else is out of it. So we're gonna have our little neck thing. Okay, this is from when I gave birth. And I was like, I'm not gonna need it after I had my son, and then got pregnant again. I was like, I need it. And then I'm like, you know what? This is just good to have whether you're having a baby or not. So my doctor says that I could jump in the shower like day of surgery, just don't face the water. Sir, no. Okay, we're not doing that. Not until them drains are out. Okay? Not until the drains are out. So I'm not getting in the shower, but I don't want to stink. So if my hoo-ha and my bootay needs a little bit of washing, right there. Okay? What else is in my box? If you've had abdominal surgery, you know, okay? The constipation is real, plus all the medications that you're gonna be on. Get yourself some stool softener. I got Purelax. My GI doctor said that Miralax, or the knockoff of Miralax, is good because it tends to use the body's natural water. I don't know. He explained it. He just said it was better that I use this one. Okay, so in the box. All right, child. What else we got in the box? Because everybody needs lip balm. Okay. Ain't nobody want to recover with dry lips. In the box. Okay. All right, y'all. Because your girl has been on high blood pressure meds for the last 2 years. Thank you, baby. Oh, okay. We check our blood pressure. We should be checking it daily, and I don't. But since I'm going to be recovering and my body's going to be going through some stuff, put it in the box, okay? So far, that's what we got in the box. All right, next. Okay, this is, oh my God. When I had my first abdominal surgery, I realized real quick, you don't want to cough or sneeze, okay? So, I don't know if it's that my anxiety gets the best of me, but every time I'm recovering, my throat starts to itch. I don't know if it's the anesthetic. I don't know if it's, like I said, anxiety, a mental thing, whatever. But coughing is the worst thing. So please, if you have abdominal surgery, get yourself, I usually get the Ricolas, but these were on sale. And it's like the same thing as a Ricola. It's an menthol cough suppressant oral anesthetic. This is like a game changer for week 1 of recovery. Get yourself this, especially if you have allergies, which I do, and you tend to sneeze and cough a lot. Like, try to suppress the cough in the box, okay? All right. Woo! We got the heavy duty stuff right here, y'all. Oxy. We got our oxycodone in the box. What else we got? We got cyclobenzaprine. Take 1 tablet 3 times a day by oral route. What is this for? I don't know. But the doctor told me to take it. In the box. Okay. Eliquis. Take 1 tablet by mouth twice a day for 14 days. I don't know what this is, but we're gonna take it. In the box. Cefalexin, 500 milligram. Take 1 capsule by mouth every 12 hours for 7 days. In the box, okay? Okay. What else is in the box? Melatonin gummies. These are sugar-free gummies. We'll also put some other types of gummies in there. If you're not into those kinds of gummies, then maybe it's not for you, but I am, okay? And we're gonna put those gummies in there when my husband buys them. What's next? We need our anastrozole in the box. We need our nifedipine for high blood pressure in the box. We need our bupropion because your girl was depressed and she don't want to be depressed no more. So we on antidepressants in the box. Okay. We got Kisqali. This is my targeted treatment in a box. And your girl has allergies. Plus, even if I didn't have allergies, I've been taking 1 tablet of this every day since starting chemotherapy. So I don't know what it is about loratadine. I don't know if I said it correctly. I don't know what it is, but it really does help with bone pain. And if you're a breast cancer survivor, you know that the bones be hurting. Okay? In the box. We are going to also sort everything out, at least the daily meds, into my narco box. As you see, it's pretty much empty. I just have my pills for tomorrow morning. So tomorrow night, I'll be filling this up so that after surgery, I can get back on my daily meds. So we're just gonna leave this up here. We're not gonna put it in the box just yet because we still gotta take meds in the morning for that one. And of course, we do a Vitafusion multivitamin for women in the box. So, as you can see, God, Lord Jesus, help me. The box is full, okay? Full of stuff. And it's gonna be downstairs with me. And it has a lid because now that the baby is 2 and quite mobile, I'm a little bit afraid, okay, of the Ophelia. We call her the Ophelia monster. Because the Ophelia jumps everywhere and grabs everything, and she tends to want to play slide on the recliners because they're so fluffy and big. And so I'm gonna put the lid on this box to hopefully deter her from touching it. And I really am gonna beg my husband and my children to stay the hell away from me, okay? Don't touch me, don't look at me, because mama gonna be in pain, especially the Ophelia. So we got everything in the box. This is like so overwhelming, I'm not gonna lie to you. It's just a lot of drugs, I've never in my life been a sick person or like a sickly child, and to be in this position right now is a little like upsetting sometimes, but it is what it is. We've accepted it. It is what it is. And a lot of these meds, like the ones that I picked up today, cyclobenzaprine, again, that's just for a few days. You know, so these are just like week 1, week 2 of recovery. Everything else, like the Kisqali, we're on it for another 2.5 years. And Anastrozole, I think we're on it for 10 years. Nifedipine and bupropion, I'm really hoping that I can get off of them soon. Like, I'm losing weight, and I think the high blood pressure meds, once I lose a little bit more weight, I think we're going to be able to take that one off of the menu. And the bupropion, we are hoping that as I continue to get used to my new normal, that I won't need the antidepressant as I've been needing it lately. I am on the lowest dose, I don't think it's the lowest dose, but I am on a low dose. But it has helped a lot. It has helped a lot because, y'all, these drugs, they do this, they do that. And then the bupropion says, oh, we'll do this. So, you know, it is what it is. And then, of course, this is daily. And yeah. Am I nervous? I'm not gonna lie, yes, I am. A little bit, you know. This will be my 5th abdominal surgery, but the first 4, I think after my 2nd abdominal surgery, I was like, I got this, child, I got this. My first one, it was 2008, and it was a myomectomy for fibroids, and it was a C-section, pretty much a C-section with no baby. It was a little uncomfortable, but I was fine. I recovered in my mom's house. I lived there in my bed. There were no recliners. My 2nd abdominal surgery was when I had my first daughter. And again, no recliner, no nothing. And I still survived. When my son was born and I had that C-section, life was so crazy that I'll be honest, I don't even remember the recovery. I don't remember. We were just going through so much in 2017. And then the C-section for my last daughter in 2024, child, that was a piece of cake. Absolute piece of cake. I don't know what it was about. Oh no, I do remember a little bit of my son's recovery because I had a morphine drip. I left the hospital like connected to narcotics. So literally I could pump myself. After I gave birth to my son, apparently they've stopped giving narcotics for C-sections. And when I had my daughter, I was on 0 narcotics, but they had me on this constant regimen of Motrin and Tylenol, which I forgot to put in the box. There, right here. Motrin, Tylenol in the box. Forgot those, put those in. And there's one more thing I'm gonna show you that I'm gonna put in the box. But yes, so my son's recovery, I remember a little bit. I don't remember a lot because, again, a lot going on in my house. But I do remember being attached to like a drip. And then, like I said, my last daughter's C-section, piece of absolute cake, okay? Piece of cake. Like literally week 1, I had to continue to remind myself, you just had surgery, because I felt fine. I was not in a lot of pain. I was recovering very, very well. No issues. And Even my sister, when she saw me, she was like, yo, did you legit just have a C-section? I was like, I know. So I was totally fine with that one. And at week 3 of my C-section recovery, I was literally a chaperone at my kids' Valentine's Day activity at their elementary school. So I was fine. With the double mastectomy, I had the recliners at this point, and they recommended, sleeping in an upright position because of the chest and whatnot. And so I, again, camped out in my living room, and it wasn't so bad. But with this surgery, I am a little bit nervous because I've got the chest being worked on and the abdomen being worked on and my back, 360. Okay, so I've heard some people say that liposuction hurts a lot. So I'm a little bit nervous about that because I've never ever done liposuction. At this point, I know what it feels like to have your titties chopped off because I had mine chopped off, okay? I know what that recovery is like. I know what an abdominal recovery is like because, y'all, I've had 4 abdominal surgeries, but never in my life have I had lipo. So I'm a little nervous on that, but we should be fine. The last thing I want to share with you, because we're not going to be taking showers, these are amazing bath sponges, rinse-free soap and shampoo infused. These are excellent. So if you're having surgery, I would totally recommend these. They work super well. And that's the box. See you on the next one.